My name is Alex Holbrook. I am an LPN in the Indiana State University LPN to BSN course. This is my first community health project. Not blowing smoke. Vaping continues to pose health risks for teens. Throughout this presentation, you should learn the following objectives. Define vaping and electronic cigarette usage. Identify vaping and electronic cigarette devices. Identify possible health issues related to vaping. Differentiate between traditional tobacco use and vaping. Identify possible interventions to help prevent teens and young adults from vaping. Before we begin the presentation, please click the link below and complete the pre-test. After you've completed the pre-test, please resume the presentation. There will be another test following the presentation. So what exactly is vaping? Vaping consists of using a battery-powered device to heat a liquid suspension and convert this suspension into a vapor. This suspension typically contains nicotine or other substances, such as THC. This vapor is then inhaled into the lungs. There are several types of vaping devices, and you should be able to recognize these. There are cig-alikes, which are disposable vaping devices that actually resemble cigarettes. There are disposable vape pens. These are single-use pre-filled vapes. They are typically sold in gas stations. There are also mods. Mods utilize a refillable tank system and have rechargeable batteries. Newer to the vaping scene are pod systems. These are rechargeable battery systems that utilize pre-filled pods that contain nicotine products or THC products. Some of them may also contain CBD oil. So we must ask, why has vaping become so popular amongst the teen population? There are several differences between vaping and traditional tobacco use that teens may find alluring. For example, electronic cigarettes can be used and more easily concealed. There is no lingering smell to clothes that is associated with tobacco usage, and the children can also stealth vape, which involves inhaling the vapor into the lungs, holding it in until there is no actual vapor upon exhalation. This allows them to use vaping in schools without detection, sometimes in the classroom if they are concealed enough, or possibly in the bathrooms. Also, vaping liquids come in a variety of different flavors that may appeal to the younger generations that do not like actual tobacco flavor. Popular flavors include menthol, candies, desserts, or just simple fruit flavoring. Also, vaping can use concentrated nicotine doses that are much higher than traditional cigarettes. For example, nicotine salts can contain a much higher dose of nicotine when compared to cigarettes. Fewer puffs result in a larger amount of nicotine. In addition to nicotine, THC can also be vaporized. Pre-filled cartridges, also known as carts, can be purchased in states where marijuana is legal. However, there are also counterfeit or homemade cartridges that can be bought off of the street. Some of these counterfeit cartridges may contain toxic dilutants or other drugs. For example, if a drug dealer would like to get a youth or a teen addicted to the THC cartridges that they sell, they may add in different drugs that are more addicting than THC. According to a report filed by the U.S. Attorney General in 2016, 13.5% of middle school students have admitted to using a vaping device, whereas 37.7% of high school students have admitted to using a vape device, and 35.8% of young adults, college age, have admitted to using a vape device. Although vaping is associated with less risk than traditional tobacco usage, that does not discount them from any health risks. Some of these liquids may contain components associated with lung injury, according to the U.S. Department of Health and Human Services. Some of these components include metals, solvents, and flavoring. While flavoring may be safe to consume orally and easily broken down in the stomach, this may not be the case when the flavorings are vaporized and entered into the lungs. A more recent issue with vaping that actually caused several deaths involved counterfeit THC cartridges. The cartridges had vitamin E acetate added as a filling product to make the product last longer. This vitamin E acetate has been associated with altering normal lung function. In addition to vaping, nicotine usage also has its own health risks for teens. Nicotine can increase the amount of dopamine secretion in the brain. It can also alter brain development in teens, affecting their learning and possibly their impulse control. Also, nicotine is associated with withdrawal when the user stops using the nicotine. Symptoms of withdrawal can make quitting quite difficult. These include irritability, anxiety, depression, and weight gain. The best strategy for prevention for getting teens to stop vaping or to never try it in the first place is to provide education for them. In a report from the Department of Health and Human Services, curiosity was reported as one of the main reasons for youths and teens in trying vaping. By removing some of this mystery, teens may be less likely to try it in the first place. Also, providing education to these same teens on quitting nicotine and educating them on possible side effects may help as well. By providing the teens with the tools they need to quit, they may have more success and less chance of relapsing. Another important step would be community outreach. Provide education and prevention strategies to parents and teachers is going to allow them to teach their children about these health effects that vaping may have on them. By parents talking to their kids, it may be less formal than in the actual classroom setting. So having a heart-to-heart conversation with your child about vaping and taking away some of the mystery may be effective. This concludes the presentation portion. Please click the link below and take the post test.